Hello. So, as being a nurse in the UK for now over an year, there's some things that I've learned. There's some things that I've been told by people, by friends, by nurses who have been international nurses who have been here for years not to do or to avoid. And some of them are the first thing is never ever cover a mistake. If you've done an error as a nurse, even if it's a drug error or any kind of error, never cover it. Go to your manager or go to a senior person and report it. Never cover a mistake. This is one mistake that you probably can cost you your nursing license if you cover a mistake and they come to discover it later. Secondly, try to join a union, a nursing union. Things do happen sometimes, mistakes happen. It's always nice to know that you have someone on your side or someone to support you. And when you find yourself in such dilemmas, your union will be a very vital part of trying to support you as a nurse. So join one of the two unions that are in the UK. The other thing that is actually very important, especially for international nurses, you were previously a nurse in your country before you came to this country. You see that registration that you have back in your country, your nursing registration, keep it active. Continue renewing your license back home. You never know what will happen. Things happen, and you need to go back home. So just know, even if you've registered as, I know friends who have registered as nurses in the US, in the UK, and in their respective home countries. So they have free registrations. Keep your home country registration active. Never let it expire. Just keep it active because you never know. Now, nurses, we come from different countries. The nurses who come from Asia, the nurses who come from the Philippines, the nurses who come from Africa, and anywhere else in the world. One thing that you need to know is keep your beliefs to yourself. Whether you're Christian, I don't know, whether you just keep it to yourself, especially when you're at the workplace. Keep your beliefs to yourself, all right? That's all I'm going to say about that. Another thing is always counter check medication. Always, always, always counter check medication. Even if there's no one there to counter check with you, you better go counter check it with the manager or counter check it with the doctor. Just have someone witness you if a medication needs to be counter checked. Please counter check it because errors happen sometimes, and or things just happen. So it's always nice to have someone else who can stand and say, yes, she did this, yes, she gave that, yes, it was the right dose. So always counter check, all right? One other important thing that I was told when I came here with my friends who have come from other countries or specifically African countries, is learn to differentiate between friends and colleagues. Your friends are at home, or you can have friends sometimes at work, but learn to differentiate between friends and colleagues. Act professional 100% of the time you're at work. Act professional, whether you have friends at work or not, but act professional and learn to differentiate between the two. That will really help you. Okay? In relation to that, keep personal things to yourself. Keep personal things to yourself. Especially, I'm going to talk about African countries because I come from Africa. And, like people are very, like people keep things to themselves. And the UK is a different country. People share personal things in the UK, and where I come from, people don't really share personal things. They keep personal things to themselves unless you're really close to someone, you know. So just learn to do that. Learn to keep personal things to yourself. Don't be oversharing things, it's just this is just a different country and different values. And I'm not saying they're bad values or whatever, but just personal things need to be personal. That's all I'm gonna say about that. Just keep personal things to yourself.